So, Erin, it's time to give some feedback based on the patients I observed with you this afternoon.
Okay.
So, how do you think your session went?
Well, first of all, I just really hate getting observed, but, you know, if I'm thinking about it, I think I, did well on what I decided to give my hypertensives. I thought I made good drug choices. I was looking at my diabetics and I checked their feet. So, I think I did pretty good, but I just hate getting observed. So, just so you know.
I understand. Actually, today's session was supposed to be about doctor-patient communication. Can you comment on how you did in that realm today?
Like I said, I hate getting observed, you know what I mean? And so that's about as good as you're going to get if you're in the room with me. It's just really embarrassing. So, sheesh. I don't know, I gotta go too. Do you know that, like, the ED's starting, my shift is starting
I
now,
wanted to give you some feedback about your work today.
Yeah, I don't really have time for feedback right now.
Hey, Erin, how you doing?
Hey, good. Good
I'm
to see you.
scheduled to observe you today with your
Yeah.
patients. The goal is to look at your doctor-patient communication and see if there's any areas that you might benefit from some feedback in. So I wondered if you had any thoughts or anything you want me to specifically look for.
Yeah, sheesh. I kind of hate getting observed, so I'm just a little nervous about how that's going to go. But
Sure.
if I think about what I really want you to focus on when you're in there with me, it'd be really great. I have this one patient, Mr. Hines, and he is always rambling on and on and on.
Okay.
I have a really hard time kind of directing that or
Okay.
any of that. So if you could tell me how I do with that.
Okay, sure, I can hone in on that. The other thing I was going to ask is, do you mind if I just shadow you on the huddle so I can hear your list? And if you have particularly challenging patients, you can just let me know who those are so I can be aware.
Yeah, that would be great. We always meet with everybody up front, in front of our suite, so we could go through it. And I think I have 3 or 4 that might be a little bit complicated.
Okay, good. I had one more suggestion, and I know because you're a second year, things are really busy. How would it be if I just observed you for 4 patients rather than your whole schedule today?
Oh, yeah, that would be great. I think that would really help to make it a little bit less stressful of a session for me.
Okay,
Okay.
great. So, Erin, I know it's the end of the session and you saw a bunch of patients. I wanted to give you some feedback.
Okay.
What we talked about before for goals. When would be a good time for you to do that?
Yeah, I just have to, I have to get a few medication refills in for some of the patients that I saw because my session was a little bit crazy and I didn't get to those. So maybe about 10 minutes, could we meet?
10 minutes? Okay.
Yeah.
Would you mind stopping over to my office right down the hall? Because that would be quiet and private.
Yeah, that would be
Okay.
great. Hi, Dr. Fogarty. I'm just coming back for the feedback that we talked about. Yeah.
Good. That was fast.
Yeah.
Just before I share any thoughts, I wondered if you had a sense of how things went for you today.
So I guess I kind of had 2 thoughts. I really like that you only came in on 4 of the patients today. I really like that you're here to observe, but if you were on all the patients, it kind of interrupts the flow a little bit. So that helped to move things along. I still really want to talk about Mr. Hines. I felt like even in that session when I thought about it beforehand, I really couldn't, help with the flow. He just rambles on so much.
Yeah,
So
we'll definitely get to that. Before we get to that, is there anything that you wanted to reflect on that you thought went well today?
yeah, I thought I did really pretty well with my time management. I don't know if you agree with that, but I saw all 8 patients. I was even able to squeeze in an acute that my secretaries asked me if I could take, and I feel like I was pretty much on time with most of them, and I just really got off a little bit with Mr. Hines. So I thought that was good.
So I really agree with your assessment. I'm really impressed as a second year that you were able to manage your time so well and really stay connected to your patients and figure out what the key concerns were and do good care. It's really hard to do that in 15 to 20-minute visits as a second year or as an attending, so you did a really nice job.
Yeah.
Do you want to talk about Mr. Hines a little bit?
Yeah, so I think what I have a hard time with is when he's rambling on and on, I don't know how to rein him back in to anything. So do you have any suggestions about how I can improve that session?
Well, I sure noticed it. Just to completely validate you, he was just all over the place. And patients like that can be really challenging. I noticed with one of your other patients who was pretty verbal, you were able to set an agenda with her up front. She looked to me like she was going to go off in different directions, and I saw you cycle back and make sure you knew what the concerns were so you could prioritize them together.
Right.
That seemed to go really well for that visit. Is that something you think you could apply to your work with Mr. Hines?
I think so. He's a lot harder, though, to kind of redirect, and I feel like he keeps rambling on and on. So I don't know if there's specific suggestions that you have for him about what I might be able to do in order to focus that a little bit more.
Sure.
Do you?
Well, first of all, this is often hard for most clinicians,
Yeah.
so just to validate that for you. The other thing is that I find that you're very kind and polite to your patients, and sometimes I think we all need to learn how to interrupt a little bit in a
Okay.
kind and polite way so that we stay on track with the visit.
Right. I guess I just was always told, like, don't interrupt your patients, let them continue to talk, and that we often cut our patients off before they really have time to give their whole story, and so I'm always struggling with that battle.
Yeah, you're absolutely right. Certainly the literature shows that we cut people off way before we should. And I don't mean that. What I mean is when you're in the process of agenda setting with him, to really try to get what his things are and really try to get him to agree with what the one or two things are that you're going to do today. And that way, once you agree, if he cycles back to another diagnosis, you can say, Mr. Hines, I know the GERD is important, but today you wanted to talk about blood pressure and back. We're not going to be able to do the GERD today.
Yeah. So that way it's saying, like, we've already established that. So
Right.
it's not like you're cutting him off to be rude. It's like just
Right.
redirecting him back to that
Right.
beginning thing. That makes a
Right.
lot of sense to me.
Okay.
So I think
Good.
with my next time I'll try that. I'll say what would you like to talk about? There's one thing that I want to talk about. We'll talk about your hypertension and back pain. And then when that GERD comes up, I can just say, let's go back. We'll talk about that at next visit. Today we are going to focus on the back pain and the hypertension. That's great.
Yeah. Okay.
That's a good idea.
I
Thanks.
agree. Okay, well, I thought you did a really nice job. I hope the feedback helps, and we can connect again in the future if you wanted to do this again.
Yeah, thanks. It was very helpful. Most of the time, my observers don't spend as much time, so I thought that was helpful. Thank
Oh,
you.
good. Well, nice job.
Bye.
Thanks.
Thanks.